6.4, our 9:09 a.m. item, presentation of proclamation designating the week of September 10th, 2023 through September 16th, 2023 as National Suicide Prevention Week. And we have Supervisor Sabatier for the presentation.
Say something, but I believe you were all here last week. We're seeing a lot of each other. So one of the beautiful things we enjoy about Lake County is there's a lot of space. Unfortunately, that creates solitude for a lot of people who may not have family living with them, who may not have neighbors right next door to them, or who may not have a social network that supports them. And so today, we want to make sure to talk about supporting these people who are feeling very down and designating the week of September 10th, 2023 through September 16th, 2023 as National Suicide Prevention Week. Last year, I believe, if I remember the numbers correct off the top of my head, there were 19 suicides in this county, and typically we hover at around 20. And so far this year through August, from the coroner's report I received, we have 12 as of August. So our numbers are unfortunately staying the same. And so reaching out, making sure people are okay, being aware of what to look for is important to make sure that we can save lives and let people know that we care. Whereas September is recognized as Suicide Prevention Awareness Month, and the week of September 10th through September 16th is National Suicide Prevention Week, which individuals, organizations, and communities bring awareness to the ongoing epidemic of suicide, bring hope to those who are struggling, offer support to those who have lost loved ones, and educate and destigmatize, provide resources and community outreach to the community in an effort to continue to prevent suicide. And whereas suicide remains the 11th leading cause of death in the United States and the second leading cause of death among individuals between the ages of 10 to 14 and 25 to 34, with 12.2 million people having thoughts of suicide, 3.2 million having made plans to attempt suicide, and 1.2 million who have attempted suicide. Those numbers are horrible. And whereas Lake County has the second highest rate of suicide per capita in California, with 16 confirmed deaths per 100,000 total population by suicide in 2021. And whereas suicide affects everyone regardless of age, ethnicity, or background, and promoting and maintaining individual and community wellness, knowing the signs and symptoms of suicide, and provide adequate services to those in need will continually help in reducing and preventing suicide. And whereas recognizing the urgency of providing prevention and intervention services available to all residents of Lake County, including those who are high at risk. And whereas there are resources available, including the 988 crisis line and text line, 741741, wish it was a little easier than just that number, crisis text line, and Lake County Behavioral Health Crisis Line for anyone who may be experiencing suicidal ideation or are concerned about someone they know who may be experiencing suicidal ideation. The Lake County Behavioral Health Prevention Team has trained 400 youth and adult community members in suicide prevention in 2023 alone. And whereas community members are urged to take action for suicide prevention and strive for zero suicides by contacting Lake County Behavioral Health Services for more information regarding suicide prevention and education efforts in and around Lake County. And whereas the month of September is recognized across the United States as Suicide Prevention Month to bring awareness and prevention to each community to help find their role in preventing suicide. Now, therefore, be it proclaimed by Lake County Behavioral Health Services and all members of the Lake County Board of Supervisors on the 19th day of September 2023 that the month of September 2023 be declared Suicide Prevention Month, and that the day of September 10th, 2023 be declared World Suicide Prevention Day. Passed and adopted this day and signed by our chair. So I'm going to pass the microphone to our team behind us. Last week we spoke about overdose awareness. Some of the same people are standing behind me. It's the same kind of touching of people and letting them know that somebody cares, somebody's aware, and somebody wants to see them change their lives and see if we can be a part of that change. So I want to pass the microphone to the next person.
I guess I can say something really quick. Good morning, Carrie Manning, Lake County Behavioral Health Services, and I have the honor of being a part of our suicide prevention team. Without them, I think our numbers would be a lot higher. And all of the staff at Behavioral Health Services, you know, our goal is to improve the health of Lake County, and part of that is making the community aware of the fact that it's okay to not be okay. And if you're not okay, reach out to somebody that you trust. And it's important for everyone to know the signs, know the words to say to someone, and be able to refer them somewhere for help. 741-741 is a great text crisis line. I've actually tested it out, and not only did I get a text, but I got a call because I didn't respond to the text that they sent me. So there is a person behind that number, 741-741, and then also 988. So thank you very much.
Thank you, Carrie. Elise Jones, Director of Behavioral Health. And not to grandstand at all, but I want Summer and Clay to come. I'm sorry, guys, I have to do this. But if you don't know, these are the faces of our crisis team, a couple of them. So this is Summer Trongo, and she's our crisis team leader. How long have you been with the department, Summer?
10 years this December.
10 years this December. And so I believe you've been mostly on crisis for that 10 years. And then Clay, how long have you been with us?
Oh my gosh, we must talk about that. The crisis,
8 years. So for a combined total of 18 years, these two individuals plus their entire team have literally been responsible for saving hundreds of Lake County lives. And to that, I am so grateful and awe-inspired. And I just want to say thank you to all of our staff. And I also want to just say, you know, a lot of us folks at Behavioral Health have lived experience with this, and that's why we're called to do this work. And just to normalize the conversation, in 2015, I had made a decision to take my own life. And so it's a risk factor for anybody. Nobody is immune to this. So the antidote to suicide is connection and relationship, right? It's building relationships with your neighbors, with your friends, with your coworkers. And that's all I wanted to say. Anybody else?
Thank you. Do we have anyone in the chambers who would like to give public comment on this item? You come on up and you can state your name and have 3 minutes.
Sorry, Jim. Come here, sweetie. Hi, Vicki Jeffers. I have used that hotline, and I was very grateful that it was there. When I first became homeless, I was pretty destitute, and I thank you guys. My mom committed suicide, and it's very devastating. It's a very serious emotion to go through your mind, to think that you could spend your last day on earth because you're depressed. And I thank you guys for being there. I think the phone number should be advertised more often so that people will call it and text it. It's very helpful. Thank you.
Thank you. Do we have anyone else who wishes to speak on this item? Okay. All right. Go ahead, Sam.